Well, depression is one of the more common mental health challenges that face many Mississippians, many Americans, many folks around the world. We're with Stephanie here at Gulf Coast NeuroSpa. Tell us about this treatment that you have.
Yeah, so we are really excited to offer Spravato. It's an S-ketamine nasal spray treatment. This is not Spravato, it's a test device.
Good to know.
Yeah, but patients self-administer the treatment in our office under direct observation of a psychiatrist and remain here for monitoring until the effects wear off.
Tell us exactly what Spravato does.
So Spravato actually acts on glutamate, which is a really novel mechanism of action for depression. Typically antidepressants act on serotonin. So it acts on glutamate, and it can relieve depressive symptoms in as early as the first 24 hours with continued relief over a period of 28 days.
Now, it's important to know that this is a treatment for adults only.
Correct. It's only FDA approved for adults with major depression. Most payers cover it, but typically they do require at least one to two failed medications prior to trying Spravato.
And you mentioned that there's also multiple ways that a patient could provide this for themselves. You mentioned that some insurances cover it. On the government side, it covers it. There's some help from Johnson & Johnson.
Yes, there are ample financial resources for Spravato. So Johnson & Johnson has patient assistance to cover the cost of the drug if it's filled at a pharmacy. And they also actually have a rebate program to cover the cost of office visit copays. So a lot of patients are able to use that, and cost is, it's really a cost-effective treatment option.
We were talking before we started the segment as if there's a patient that is not seeking the treatment because they're not able to pay for it. That's a concern.
Yes, all of our staff at Gulf Coast NeuroSpa know that if a patient's declining treatment due to ability to pay, that something's wrong, and we should look further into it because there's a lot of pathways to access it.
That's great, because that's just not something, unfortunately, that happens for everybody in every situation. And it's good to know that you guys are really helping patients get the care they need.
Yeah, we really go to great lengths to make sure that everyone can access some sort of some treatment to depression, whether it's TMS or through Spravato. From a cost standpoint and a convenience standpoint, we try to accommodate patients in every aspect. And
TMS is a treatment that is available for adolescents. So if you have a child that you want to have seen, that is possible. Not with Spravato, that's just for adults.
Correct.
Right. So let's talk about the space, because I'll tell you, having walked around here now for a few moments, it's called Gulf Coast NeuroSpa. It feels a lot like a spa. It doesn't feel like a clinic. It doesn't feel like a hospital. Like, just taking a look at the ambiance and the general decor, feels completely different. It feels like I could let my guard down and really embrace the treatment.
Well, thank you. A lot of our clinic design was actually based on patient feedback. Spravato particularly is a really unique treatment, and it feels like a really unique experience. So patient feedback was really important. We were really relying on our patients to kind of shape the whole experience and be as comfortable as possible. Yeah, I mean, we're taking a look right now at these recliners. Like, I feel like this is just like a sitting room in someone's house. Yeah, a lot of patients during their Spravato treatment, while they're here being monitored for 2 hours, they like to recline and take a nap or listen to music or get as comfortable as possible. So all of our chairs are equipped with a massage function and a heat function, electric reclining and power lift. And we also have tables with anything they could need, from candy to headphones or neck pillows. Some nice treats here. I have noticed the selection of candy and snacks. So you mentioned that the treatment is a 2-hour process. Why, what does it take? What takes 2 hours? What's the process? So the effects of Spravato can cause an increase in blood pressure, and it can cause sedation or some dissociation. Typically those effects wear off within 2 hours. So the patient has to remain on site until the effects wear off and they're medically cleared to leave. And then someone has to come pick them up. Correct. They can't drive themselves home from Spravato. Unfortunately, it's an FDA requirement. So we do require that patients have a driver or ride share or some means of transportation to get home. And there's no kind of you don't have to fast for this, you don't have to do blood work for this. Like, this is just a treatment you can come in, be seen, and it can be recommended super easy. Correct. There's some contraindications, like some vascular disease, or a hypersensitivity to ketamine, any history of that, intracerebral hemorrhage, and your age. But other than that, our psychiatrists conduct a comprehensive evaluation to make sure patients are a good fit. And their blood pressure does have to be in a healthy range the day of treatment prior to starting treatment.
Now, we're not talking about an injectable, this is super easy. How does this work?
So this is the Spravato device. This is a test device.
Sure.
So there is no Spravato in this, but it works exactly like this. So the patients place it in their nose, lean back about 45 degrees, and squirt one spray into one nostril, and they do it again into the other nostril, recline, and each patient has either 2 or 3 devices, depending on their dose. And then they just relax for 2 hours.
And this is it a mist? Is it just something that you have to inhale? Like, how does that work?
Yeah, it's a nasal spray, like a mist. So
Sure.
we want it to rest in the sinus cavity.
And then I know you mentioned, again, before we started shooting, there are some patients who, on their first time, they really don't know what's going on. Speak to those folks now, if they're watching now and they may be interested in something like this. Help them feel comfortable about even having a conversation about this.
Sure, that's a great point. We do have a semi-group setting, so we also offer a private room for our initial treatment while patients kind of get the feel for what to expect and how they may react to the treatment. Our physicians are on site, nurse practitioner on site during the whole treatment and available. But we do try to offer as much privacy for their comfort as we can.
And is this a medication to add to anything that anyone might be taking for their condition, or is this something that you eventually replace? How does that work?
So for both TMS and Spravato, we offer really individualized plans for every patient. Okay. Some patients continue their medication. Some patients might not be on medication at all coming here, and now with a new FDA approval for Spravato, they don't have to take it with an oral antidepressant. And you can also continue your medications and take it. All of those options are approved, and it just depends on patient preference and their provider's recommendations.
I guess the key is that it's okay to not feel okay, right? But the key is when you feel like something is a little off, to ask questions and get answers.
Yeah, definitely seek treatment, seek an assessment. At worst, it's just an educational opportunity to learn about what's out there. You can come in for an assessment and start treatment later on, or not start at all. We really care about spreading awareness and education about what we do. Absolutely.
So listen, if you've got questions, you see that number there at the bottom of your screen. You see all the information there that you need to contact Stephanie and these folks here at Gulf Coast NeuroSpa. They have 2 locations, Ocean Springs and Gulfport, and they're ready to help you. Awesome.
Yeah, thank you.
Thank you, Stephanie.